All right, the Brazilian butt lift or the Brazilian butt facelift. So here, this is the thing. The FaceBBL, what is it? What can I do with it? What are the goals? Why are we talking about it? So the FaceBBL, this is taking fat from one area in the face, transferring it to another area to help create a peak, a little bit of a valley, straight peak, a little bit of a valley. So, you know, the key here really is when I want to make a valley, I take fat out. When I want to make a peak, I put fat back in, excess fat back in to kind of create these peaks and valleys. So very similar to the Brazilian butt lift, that's taking fat from your belly, put it in the butt to create that big curve. Or putting in the breast, for instance, there's fat transfer to the breast. I'm doing the same thing in the face to create these kind of peaks and valleys, these shadows and curves. We're manipulating the fat redistribution to create these different peaks and valleys, these contours. You know, it really can make your face look more sculpted depending on where the fat is. So it's about volume in the right spots. Volume in one spot, adding volume to one spot, taking volume from another spot, kind of creating those curves. That's what people like. They like these angles, this sculpted, this sharpness, or what many people like. It's what I like, and it's what many people who see me like. So the FaceBBL is just that. Now, everybody gets a little bit of a different aspect of it. Some people need higher fat. Some people need me to put it up into the temples, into the upper thirds. Some people a little bit more in the apple cheek. And then similarly, some people I'll take more of the fat from here. Even in a small group, I'll take it from the belly or the lateral thigh, just to kind of give them a little extra pop there. So the FaceBBL, that's how there's the Brazilian butt lift, then there's the FaceBBL. I don't do any body, so this is all in the face, but it's using the fat volumes of the face, the fat pads of the face to create these peaks and valleys for these shadows and curves, to create this contour, this shadowed, sculpted look. I don't take the ass fat and put it in your face. I take the fat I try to take it from different areas of the face and neck because I can, harvesting some of that fat can create some of the valley, and then I put it in the area we want the peak. So it's just redistributing the fat to a more aesthetic, sculpted, sharper look. You can take some from the belly. You can take it from the lateral thigh. Most people like the fat in their booty these days, so you don't typically want to take it from there, but there's risk to everything we do. It's interesting. Bruce Lee quote says, I fear not the man who has practiced 10,000 different kicks, but the man who has practiced one kick 10,000 times. So that's kind of what I've become, I've done, thousands of these lower face, jawlines, BBL, sculpting, fat redistribution cases, and I'm using that to kind of build and sculpt, and that's how you reduce the risk. So back to the risk question, there are risks, but the more we do, the more we're able to decrease those risks. The facial fat layers, the facial fat pad, so there's superficial fat, there's deep fat. So for instance, the orbital fat inside the eye is a deep fat pad. It's glistening, it's globular, it's big. The buccal fat is very similar to the orbital fat. It's this deep fat pad. And then there's superficial fat, like the fat under your belly, it's just under the skin, or the fat right under your face, that leads to the aging component. So the layers of the face go like this. There's skin. The skin has epidermis and dermis. Deep to the dermis, there's subcutaneous fat. That's the good fat. That's the fat you want to keep. That's what keeps your skin looking nice. I'm starting to lose my subcutaneous fat. That's why you're seeing separation there, making me look old. Then there's the arteries, the orbicularis around the mouth, the risorius, the zygomaticus, the levator, the depressor, the orbicularis around the eye. Then there's the parotid gland, the parotid duct, the facial artery, the facial nerve, the facial vein. Deep to all that is the buccal fat. That's why we go from the mouth to get to it. So that creates this smooth contour. The buccal fat maintains its size over time. It can actually engorge and get bigger and pseudo herniate, very similar to the orbital fat in people. There's the classic example of Ruth Bader Ginsburg, where she has this bulging buccal fat. So those are people that as they age, it leads to this bulldog look. So they have different stem cell contents, they have different architectures. If you really nerd out about it, you'll learn that. People will see the benefit of manipulating the buccal fat pad. Okay, all you gotta do is subscribe. You're gonna feel hotter as soon as you press the button.